Guys, it's Becky Bamboo. Today is Tuesday, March 4th, 2014. I have some news I need to share with you all. I have not been feeling well the past couple of weeks, so actually over the weekend I felt pretty terrible. I had an episode where I was really sick with when I was eating, and lightheaded, dizzy, sweaty, just really like having some stomach pain and stuff. My parents actually wanted to take me to the emergency room, but I said I was not going to go, that I was going to wait and call my bariatric surgeon on Monday, which I did. So I saw him today. Basically, I thought my gallbladder was going bad, and I explained all of my symptoms to him, which has basically been 2 weeks of diarrhea every day. Anytime I eat, I get really nauseated, can't really eat a lot, not have much appetite, don't have much energy, just not feeling like myself. He said my symptoms are classic for an internal hernia and possibly a partial bowel obstruction. So basically what happens is when he rerouted my intestine, all the mesentery, the lining in there, every time they suture, of course, they create a hole. Well, that's like a fatty layer, and as I lost all my massive weight loss, the fatty layer basically loses weight too, and those holes that are created get bigger and bigger and bigger, which allow other portions of bowel to kind of snake back inside there. They can get twisted up, they can get pinched off, cause obstructions, they can cause where like the blood flow is cut off and that portion of the bowel can die. Basically, this is a very serious thing that can happen. If that were to happen, if the bowel were to die, I could also die, and it's something that can happen pretty quickly. So he thinks we caught this early. He thinks that I caught this early, which is good. And basically, we are going to do surgery on Monday. I'm having a laparoscopic procedure done to go in and fix the hernia and untangle whatever bowel is all tangled up or obstructed or whatever it is. He sent me today also to have a ultrasound of my gallbladder done, because he said if it's got any stones at all, we're going to go ahead and just take it out while we're in there. However, the preliminary report on my ultrasound shows that my gallbladder is healthy and normal. So that's a good thing. I'll be 4 years post-op in June, so we're getting, I'm getting pretty far out, and to have a healthy gallbladder at this point is not a bad thing at all. That's a blessing. But I don't feel well, so I'm ready to get fixed. I'm not thrilled that it's an emergency surgery that I'm having to have to get fixed, but if that's what it takes, that is what it takes. When I signed up for gastric bypass surgery, I knew I was signing up for the risk of complications for the rest of my life. It's not just immediately after surgery that there's a risk. This is a risk for the rest of my life. So, I firmly believe that we should be really cautious and listening to our bodies. I knew something's not right. I don't want anybody else touching my tummy except for my bariatric surgeon. I trust him. I know he knows what he's doing, and I won't have anybody else handle it unless it's somebody that he's referred me to. So, when I called Monday, I said, I got a problem. I really need to see him. They got me right in today. And he said, you did exactly what I want you to do, which is to come in and see me. He said, I have so many patients who think something's wrong. They just go to whatever hospital. They get surgery from some clown who doesn't know anything about bariatric surgery, and then they end up worse off. I'm just not willing to take risks, I've taken this very seriously. I do my best to protect my belly, protect my my pouch, and to follow what he wants me to do. So anyway, surgery is Monday. So I will try to update you guys as soon as I can afterwards, let you know everything went fine. Most of you guys follow me on Facebook, so you're going to have the update long before I'm going to do a video. The other thing is, I just really want to encourage people, if you think something's wrong, something's probably wrong. So get it looked at. Don't wait, because if this is something that if I had waited on, it's something that could have killed me. Basically, if I have any trouble between now and Monday, he's going to do the surgery immediately. I just have to call him and tell him I'm really sick. We got to do this now. So he's trying to get me on the schedule is what he's trying to do. And he's trying to give me a little bit of time. You're okay. Come here. Come on. No. No. Do you want some waffles? No. You want some crackers? No. What do you want? What do you want? You're saying cracker, but then you tell me no. Oh, children. So anyway, basically the gist is that I'm going to have surgery. I'm going to be out of work a week or two. Don't know. Depends on how I recover. Depends on what all they have to do. There's always the risk of this being an open procedure rather than laparoscopic, depending on how things look when they get in there, of course. What do you want? No. No. I don't foresee that happening. I choose to look at the positives of things, and I just think my surgeon knows what he's doing. I trust him. I think everything's going to be fine, and I'm going to feel better and move on, because right now I don't like this, not being able to eat. I don't like having diarrhea every day. I'm over it. I don't like the pain in my gut. I'm done with it, It's just tiring. It's old. So I actually, I have to, I've lost my train of thought now. Oh, I guess I'll give you an update on what else has been going on. I've actually lost about 12 pounds in the last few weeks. Some of that is by my own doing, because I've really been, diligent about eating the way that I should eat. But part of it, I'm sure, is that I really have been sick and I really haven't been feeling well. I met with my trainer today. We didn't really do a lot because I told him, I'm like, look, I don't feel good. I'm seeing my surgeon today. I don't know what's going on. He actually took measurements on me, and so that's kind of that's a first time that we've done that. First time I've ever had somebody do that to me, which was was different, kind of neat. We had fun with that. And then, of course, when I found out about this surgery, I had to call him and say, yeah, so I'm not going to really be able to work out for a little bit because I'm having surgery. He's pretty shocked, though when I talked to him today, I told him I really suspect surgery's coming. And so, he was like, you were dead on. I'm like, well, you kind of just have a suspicion about these things. If you're listening to your body, you kind of just start to know what's going on with it. Excuse me. So, I guess my training is going to kind of be put on hold, but my body's, feeling pretty strong right now. So hopefully that will be a benefit for the surgery, that I will, that I'm in good shape, that hopefully I'll bounce back quickly, that, so I'm going to be glad that I've been doing all the working out that I've been doing. And he said this morning, we've got to take your measurements because your body's changing a lot. Like you're looking totally different every time I see you. You're dropping weight and you're really starting to firm up in certain places, and it makes you feel good, makes the work worthwhile. I guess that's it. I don't have much else. I got to get this little guy some dinner. I miss all of you. I'm going to say thank you in advance, because I know all of you are going to shower me with love and support through this process. And that's the one thing I love the most about this community, is that anytime I need something, I got a place to lean. And right now I need to lean because I'm a little nervous about this whole thing. I'm not really excited about it at all. So, anyway, I love you guys, and I'll see you on the flip side of this surgery. Mwah.